legislature.
Thanks for watching TMA's Legislative News Hotline for Friday, February 27th. I'm Brent Anier. This week, we discuss the current status of the state budget, hear from a doctor who warned lawmakers of a new threat to Texas children, and tell you about a possible tax cut coming your way. First, here with the latest on the budget is TMA's Vice President of Advocacy, Darren Whitehurst.
Here we are today in day 46 of the legislative session. There are 94 days left. Most of the work thus far that the legislature has undertaken has been related to the budget. And there is a lot of effort. If you've been reading in the paper, you know that there's a lot of effort going on both the House and Senate side. This session, the bill is going to be a House bill, so the House is divided into subcommittees and been going through work. And actually this week and part of next week, they're going to be focusing on riders to the budget. A lot of activity. Probably start with the fact that I think that both the House and Senate have a major desire to do tax cuts, and how this impacts medicine and other groups out there is that the tax cut directly impact the ability to do other things within the budget. And there's always more need than there is the ability to provide funding for. So if they're talking about $4.5 billion, I think I told you before there was about a little over $8 billion to spend before you get to the spending cap amount. That means that there's probably about $4 billion that are going to be interspersed within the budget, dealing with health care, dealing with education, dealing with transportation, dealing with other issues, other priorities that the legislature has. We've been working very closely with the members on the Article 2 subcommittee, on the members on the Article 3 subcommittee, but actually we have things that impact medicine on all of these subcommittees and have been working with each one, both on the overall budget size as well as specific riders that we will be dealing with. We have a First Tuesday coming up, and one of the priorities, one of the handouts that we have is specific on the budget. We also have a number of other issues that we've been working on. Expect next week for the committees really to get down to work on policy-related issues impacting the state of Texas, and we'll be visiting with you very soon in the future about those issues. Thank you.
Physicians and other professions might owe $200 less in taxes if Senator Kevin Eltife gets his wish. He filed Senate Bill 765, which would eliminate the $200 occupation tax. The law began taxing doctors in 1991, but since 2007, physicians and the other affected professions also pay the state's franchise tax. TMA's Troy Alexander explains how eliminating the occupation tax is a good move for doctors and other professionals.
The repeal of the occupation tax matters because this is extra burden placed onto professionals in this state that adds to the cost of doing business here. And anytime you're adding to the cost of doing business, it limits the ability to do expansion, to put resources where resources are needed more. And in addition to areas it costs providers such as physicians, as well as other providers who are included in the tax, more to practice, thus it translates into the higher cost of health care. And these are not things that we want to see in the state of Texas, because we want to try to reverse the trend of healthcare costs. Texas Medical Association is really grateful to Senator Eltife for his leadership in pushing this issue forward. We are also grateful to leaders in both chambers who are continuing to have dialogue with us about the priority of this issue, and we hope to have success.
An e-cigarette regulation bill passed the Senate Health and Human Services Committee this week. Senate Bill 97 by Senator Juan Chuy Hinojosa would regulate the sale, distribution, possession, use, and advertising of vapor or e-cigarette products to minors. Dr. Joel Dunnington, a former member of TMA's Council on Public Health, this week asked the House Public Education Committee to support House Bill 456 by Representative Roland Gutierrez. Dr. Dunnington told legislators he believes e-cigarettes are dangerous, especially for minors.
This is a way of getting kids to take up nicotine, and nicotine is extremely addicting. Nicotine are in most of these e-cigarettes. I think this is a way of normalizing smoking again, where we've spent the last 30 years trying to denormalize tobacco use in the United States and in Texas.
41 states already prohibit the sale of electronic cigarettes to minors. The Capitol will be buzzing with physicians and TMA Alliance members this coming Tuesday, March 3rd. It's the second of 4 TMA's first Tuesdays at the Capitol this year. TMA is expecting a crowd of nearly 200, like this group from Lubbock who visited this House member last month. Young and newly licensed physicians have dominated the registration list for March 3rd, as well as a record group of TMA Alliance members. We hope you can join us too next Tuesday. Visit texmed.org/firsttuesdays for info or to sign up. That's all for now. I'm Brent Anier with TMA. Please join us again next week for TMA's Legislative News Hotline.